40% of those admitted to a hospital or nursing home will never return to independent living, and 25% of them will die within a year. So the 18,000, those are the ones that die as an immediate result of the fall, but there's another couple of 100,000 that die within a year as a result of that fall. This is pretty big stuff. This is pretty devastating. And when is the best time to develop your skills to avoid falling? Right now or when you're 65, right? It's an ongoing process because that strength of the brain is something that we develop and maintain and build over a lifetime. And this is where we get to the real topic of today, and this is equally huge. Inhibition of secondary stimuli. This is the ability to focus, because in order for you to listen to me rather than the thunder outside, you have to actively spend brain energy, brain calories, to block those signals. Those signals are hitting your nervous system, but you choose, hopefully, to turn those off and listen to me. And that is the ability to focus. The brain has to turn off secondary stimuli in order for you to do that, because otherwise you could never choose what to focus on. Everything would hit you equally. And that's what happens to people with really bad ADD. They try to listen, and then something happens, and their attention is over here, and then it's over here, and then it's over here, and then it's with their thoughts, and it's out the window, and what am I going to do next? And oh, I'm supposed to be here. The brain does not have that strength to maintain an inhibition of secondary stimuli. And this holds true for everything else that we're going to cover. We'll do this pretty quick here. Depression is nothing more than a tendency to think depressing thoughts. That sounds real simple. I mean, it's not easy once you're in that mode because it's a self-serving loop, but that is really all it is. It is about it's a tendency to think depressing thoughts, and your cortex does not have the ability to go in and interrupt that pattern. So depression literally means depressed brain function. That's what it is. And therefore you get depressed emotions and you feel really bad and you want to kill yourself and so forth. Same thing with anxiety. Anxiety attacks, it's a tendency to pick up an inability to block anxious thoughts and things that you don't want to pay attention and focus on. At one level, it's purely the brain function, the ability of the brain, and the second level, it's a practice. Just like everything else that we have to practice, do you practice depressing thoughts or do you practice happy thoughts? Because most people don't realize they have a choice, and you do. Most people think that they are obligated to focus on what's in front of them and read the news and listen to people who complain, but that's short term. You have a choice, and that's what determines the balance. Same thing with chronic pain. If you remember the summation diagram, pain is not an absolute thing. Pain, we think that, oh, well, the pain, it hurts in my foot and my brain is perceiving the pain. We think intuitively that's an absolute thing because the pain is so real to us. But if we have enough inhibitory signals, inhibitory synapses on the brain cell perceiving the pain, the brain can choose to feel the pain or not. And therefore pain is not a real thing. And that's why depressed people have more pain. They have more chronic pain. And people with fibromyalgia, same thing. Anger, similar principle. It's an inability to inhibit impulses of anger. Social norms. This is a good one. If you think about how we behave in social environments, we think that, oh, well, it's obvious. We all know what appropriate behavior is. But babies, they cry in public. They scream, they have tantrums, they make a scene. Why? Because they don't have developed the brain capacity to inhibit those impulses. As we get older, we develop the ability to inhibit it, and now we know what's inappropriate or not. But at the brain level, that is exactly what's happening. The brain is what inhibits that. And sometimes people with strokes, they strike out that portion that inhibits that, and they completely lose their social manners. They're intelligent, they can function in many ways, and all of a sudden they start cursing and yelling in public or at their loved ones. Often this happens with Alzheimer's as well. And it's not an absolute thing, it's the brain's ability to inhibit that behavior. We all have those impulses, but the brain keeps them in check when things are working. Why do teens act so stupid? Why are they so reckless? Why do they kill themselves on the road? Because the brain is not fully developed. The frontal lobe, which inhibits this stuff, is not fully developed until age 25. So the 16-year-old that gets the driver's license, they do not have a mature brain. So when someone says, oh, drive through that red light, he thinks that's a good idea. Occasionally, some of the more stupid ones. But it's an inability to inhibit that type of behavior. And it's an undeveloped. Sometimes you'll have, I mentioned that with Alzheimer's or strokes, that older people all of a sudden start losing their social manners. They start cursing, they start yelling, they start having outbursts. And their brain is too weak to dampen those impulses. Starting to get the picture? And a lot of what we call aging is nothing more than a gradually degenerating brain that doesn't have the ability to manage and monitor this anymore. So let's just round this off. And again, I appreciate you coming in here. As you see, we haven't talked about back pain. We haven't talked about bone out of place, putting pressure on a nerve. Most people who go to a chiropractor, they look up chiropractor in the phone book or on the internet. They look for those things. But that's not what chiropractic is about. Once you start seeing the bigger picture, the last slide I label it back pain, schmack pain. It's like, in the bigger context, yes, of course, if you suffer back pain, that's important. But that's such a tiny little piece of what this is about. It's about function, it's about life quality, and it's about joy at all ages. So when someone comes in with pain, yes, we want to help them feel better, but the pain is always an indicator of something else that isn't working. And what is it that's not working? If we understand the body properly, we know that the brain regulates everything in the body. So if there's a problem in the body, if there's an imbalance in the body, there's always an imbalance in the brain first. Unless it's an acute trauma that we can identify, everything else starts in the brain first. So when we fix the pain, we make something work better in the brain. But that brain also regulates everything else that we talked about. So if we make the pain go away and we make that work better, that means that we've increased their likelihood of not falling, we've increased their likelihood of not getting high blood pressure, we've reduced their tendency for ADD and antisocial behavior, we've increased their ability for a joyous life. But it doesn't happen in a couple of visits. And I know I'm preaching to the choir here, but that's the bigger picture. So again, I thank you very much for coming, and we'll hope to see you back next time. And please bring someone that you care about that needs to know this stuff. Thank you.